Hey guys, welcome to victoryhealth.tv. I'm your health coach, Dr. Jake from victoryhealthcenter.com. If you have any questions about who we are or what we do, go to victoryhealthcenter.com. You can also go to the radio show, victoryhealthradio.com, and then I'll share some more ways to connect with the clinic. Today is my very favorite topic of everything. I'm a corrective care chiropractor. I'm very passionate about the way that the body works and the way that the body functions. And so I always get super excited when I get a chance to talk about this. And I think that so many times that we consider the spine and the nervous system, number one, when you hear the word neurology, we tend to get like confused, or we don't think that that we're out of our league, and only a neurologist can talk about neurology or brain function or spinal cord or any of that. But the truth is it's in all of us. It made us who we are, and it controls every single cell, tissue, organ, function. Everything in your body is controlled by the brain and the spinal cord. And so when you really think about, and this is my favorite picture of any nervous system out there, is that really shows the connections between it all. And in your body, the nervous system controls the function of every one of those organs that you're seeing, your muscles, every single tissue. Your nervous system is made up of what's called the brain and the spinal cord. And then you have your skull and your spine. Those protect your brain and your spinal cord. When you look at a spine and it's just solo, it's by itself. When you look at the spine from the front, it's supposed to be straight up and down. And if there are curves on that right side, if you're watching this today, that would be a sign of a scoliosis. And so the spine's supposed to be straight up and down from front to back, and it's supposed to have three curves in it like this from on the side. And a curve forward in your neck or your arc of life, the back in your back and forward in your lower back. Your spine is like any other body part. The heart, it needs to be properly maintained throughout your life, your teeth, but your spine does as well. And because of these things that you do every single day, we don't sit properly. A lot of times we're not lifting properly. Women go through the birth process and their pelvis shifts, and then it closes back up, and it gets stuck. The stress that you go through every single day, the car accidents that you've had throughout your life, the little slips and falls when you were 5 and 6 years old, they may catch up to you when you get older. And childhood injuries, all of those things. It causes your body to shift out of alignment. And the spine is designed to do one single thing, which is to protect the nervous system. The brain and the spinal cord, when these bones are in the correct position, they work the way that they're supposed to work. But when these vertebrae, and that's what these are called, so in here you have 7 vertebrae in your neck, and this is the top bone in the neck. I'll put a skull on one of these pictures here in a second. And then as we go down, you've got 7 bones in your neck. You've got 12 bones in your thoracic spine or your mid back, and then you have 5 bones, including excluding your sacrum, which is a separate bone in your lumbar spine. And ultimately, when these vertebrae they shift out of place, they put pressure on the nerves that go into these organs. And so you've probably seen a picture like this before that puts the sacrum here at the bottom, and you've got the pelvis. This is where the hips would attach into the body, of course. The ribs are all connected into these vertebrae. And then right here would be the scapula. And I think a more detailed picture is this one. These are the nerve innervations. These are the nerves that come off of that spinal cord. And this is from a book by an anatomist. His name was Frank Netter, and it just shows you a more complete version of it. And so when we look at this, though, when we look at it from a organ standpoint, these specific nerves go to very specific tissues and organs in your body. And we know that when we see an x-ray, or when you come into the clinic, or when you come into any chiropractic clinic, that the blood supply to the head, the pituitary gland, the bones of the face, the inner and the middle ear, the activation of the sympathetic nervous system, that happens at C1. And so if there's a problem and there's damage, there's a misalignment, also known as a subluxation. If there's a misalignment of that bone and it's putting pressure on that nerve, what it was supposed to be protecting, now it is damaging. And the effects of misalignments can be for that nerve. It could be headaches or nervousness, insomnia, head colds, high blood pressure even. There was a study from the University of Chicago, I think in 2007, that said that a chiropractic adjustment and realigning that bone can lower the blood pressure of that patient by up to 2 blood pressure medications. And so it's advocated that if you have any issue, make sure that you're getting your nervous system checked to make sure that there's not other stuff going on inside of your body. This is a good nerve that a lot of people know about, and it's called the sciatic nerve. And it's a branch off the L3, L4, L5 vertebra and comes down the leg and into the feet. And if you've ever had a friend, or if you've ever dealt with any kind of sciatica or nerve pain that goes into your leg, that's important to understand that nerve is not just going into your butt. That nerve is not just going into your leg. That nerve is going into the prostate. The nerve is going into female organs, into your knees. And so for your knees to regenerate and for blood flow to be normal, there has to be normal nervous system flow inside of the body. This is a picture of the spinal cord without the brain and the innervations of the organs. And so the point of all these pictures is just to help you understand that it's critically important that we take care of this thing. Now, when we talk about the spine, the way that we're so miraculously designed is that from the moment that we start crawling, we start to develop a stability and a resilience in our spine. And once we begin to crawl, the curve in that lower back begins to develop. This is why crawling is so important. And the bumper seats and these other seats, the bouncy seats that where the child can bounce up and down and maybe even walk before crawling, are harmful, because the child does not get an opportunity to develop those curves. Now, in here is when the baby starts to look up, they start to strengthen these posterior muscles and these postural muscles, and when they're looking up, they're developing the C-shaped curve in the neck. And this is almost an engineering thing. The majority of the strongest structures in the history of man have this 43 to 45 degree angle in there. And so there's no coincidence that the way that our body's developed is developed to be strong, and specifically for the spinal cord to be protected, it needs to be protected by an in alignment spine. The cervical curve is called the arc of life, and losing those curves in your neck, losing this curve in your neck, is absolutely devastating to the body. The top picture that you're seeing there on the left is a normal spine. It's a C-shaped curved spine, supposed to be like that. That top bone in the neck is supposed to be shooting up towards the sky. That allows for space for the brain stem to come through this big hole that is in the bottom of your head. That spine on the right and the spine on the left, that is the same person. The spine on the right is a result of damage from physical, chemical, and emotional trauma over approximately about 15 years or so. And you can read that and see that by reading bone spurs. And so they're called osteophytes that land on the fronts of the bones. This is a totally normal, exactly what this is supposed to be like. That top bone shooting up towards the sky. Supposed to be a gap between the skull and the top bone. And once again, those are ear infections when that bone gets misaligned. Those are anxiety, and it can even affect the way that your pituitary produces hormones when that top bone is not shooting up towards the sky like that. Rounding out this cervical curve in here is just critically important for allowing the spinal cord to be slack. And so when you see a cadaver study, you see this one that's in here on the left. That is a completely normal spine, and the spinal cord has actually got wrinkles in it because it's so slack. In here, when we start to go through stress, physical trauma, maybe it's car wreck, or it could have been you've been sitting at a computer for the last 15 years. It could have been that 17 years ago you lost a family member that was dear to you and it wrecked you. It could have been a horrible divorce, or even the anticipation and running up into a wonderful marriage. It could have beaten the snot out of you. And so we see this every single day at Victory. If you don't fix this and the head starts to sit, not not on the back of the bones like it would be in a C-shaped curve here. When it starts to ride on the fronts of the bones, it starts to cause degeneration. And the fluid that's in those cervical discs right there, it starts to drain. It starts to leak out. It starts to compress. And that's called degenerative disc disease. And if you don't take care of your spine, it will decay just like this. This is another good solid picture of that spinal cord that I was talking about a few minutes ago. Is you've got a big fat space for that spinal cord to come through. As it goes down through here, it's got a little bit of a wrinkle even because it's loose. It's slack. Okay, in the spinal cord, you want from the sides C-shaped curves and from the front to be straight. You don't want to see a straight spine where there is supposed to be curves, and you can see the damage that happened to that disc even right there because of the pressure of the head weighting down and causing degeneration. This is what a lumbar spine looks like, or a low back spine. It's supposed to be straight up and down from front to back, and it's supposed to have a curve in it. Same thing all the way up top. You're supposed to have a C-shaped curve, a C-shaped curve, and then a C-shaped curve. As we age and as we start to lose those curves, it starts to straighten out and cause tension. And now, guess what? There's pressure on the fronts of the bones, just like in the cervical curve, in the neck spine, and the juice that's in these discs, it starts to poke out, and now we have disc herniations. The mid back, people here don't really lose your curve very much. Um, this is where you see a lot of older people though hunched over, and this is because everything that we do at work is typing, it's reaching out, it's in front of us, it's lifting, and we spend so much time sitting down. It's so important to have good posture, or at least do some kind of posture work at your desk. And so this is the ideal position on the left for your posture at work, and on the right side, obviously you're not supposed to be straight, leaning forward toward the computer. Even the majority of work injuries don't occur because of some accident. It's because of repetitive motions. And so if we look at what you do in your daily life, what's causing you to lose those curves in your neck, you can begin to lose those curves by looking down, simply reading, using a computer for an extended period of time every single day. How many of the people that you know have a similar illustration to the one on the right as far as their posture goes, as far as the way that they're working on their computer? They're you're not sitting back on their butt. They're sitting on their thighs, on the back of their thighs. So important to have good posture at work. There's a lot of people out there, and what I was saying just now is that we have repetitive micro traumas. We do the same thing over and over and over again. And research shows that 80 to 90% of work-related injuries are repetitive action injuries. Not just that, but we sleep funky. I've seen these wallets, these big wallets that guys. I don't know why we're packing so many receipts into our um, into our wallet, but we do that apparently. Um, Using your phone that's not in a proper way, tucking your chin, sitting on the couch. I see this a lot, sitting on the couch and tucking their chin real hard, looking down at their computer. Handbags that are too heavy, and they always are wearing, or you're always wearing it on the same shoulder. You should switch that up. And so think about like a hanger. If you pull on a hanger, pretty rapidly, it bounces back. But what would happen if you took that hanger and held it in place for 8 hours a day, 5 days a week, 50 weeks a year? That wire hanger starts to take on the shape of the weight that you put on it. There's a lot of new discoveries with chiropractic and the nervous system, and what it means to have a proper nervous system, but also how important it is for us to move our spine. There are videos and studies that support the relationship between movement and the visual system, movement and the way that you speak, and the amount that you can learn, and the languages systems that you can learn, movement and memory, movement and attention. They suggest a relationship in the cerebellum in such mental processes, predicting, sequencing, um, ordering, timing, practicing, rehearsing, just every single task before it comes out. And the cerebellum can make a predictive and corrective action regardless of whether it's dealing with something that's really happening or something that's been thought about. And so it's just as important while you are learning to be moving. And um, the brain is instantly and spontaneously creating new tools for better function with minimal and precise precision. Minimal is 15 minutes of continuous stimulation to the nervous system. Precise means it's an actual exact movement. The biggest reason spinal movement is important is that the brain can instantly and spontaneously create new tools for better functioning with minimal and precise stimulation. We are talking about neuroplasticity, that your brain can learn things still today, even as we age. But it needs to happen in small increments, 15 minutes, in very exact thought processes and very exact movements to develop it's almost like a neural groove that happens, or a neural rut that you want to train your brain, and you train your brain how to function. At Victory, we know that novel movements enhance the ability to learn and develop our brain. And so this wobble cushion that we use at the clinic, we recommend it to basically to increase motion in the spine, to rehydrate the discs that are in the spine. The motion for children, even when they're autistic or ADHD and ADHD, their learning is improved after experiencing figure 8 motions while riding on a horse. And so you can develop the same kind of motion on one of these wobble cushions. When you wobble, the compression motion done repetitively, it pumps nutrients, oxygen, and fluid called cerebral spinal fluid into the disc cells, nourishes and rehydrates them, and simultaneously pumps damaged tissue cell waste out of the spinal disc. Cerebral spinal fluid carries nutrients, neurotransmitters, and hormones. The brain and the nerves need to communicate with this to be healthy. And when this is recirculated, it's refreshed. It enhances your mood. It enhances your attention span, your memory, your focus, and your cognitive function. That motion that you do when you're doing the front to back. So this is the back of the spine. This is the front of the spine. When you're looking at the side, of course, this is the left and that's right. What we're talking about is when the spine moves from side to side. When you squeeze on one side, fluid goes out on the other side. And so it's kind of like a wash on the inside. The movement doing these things in your daily routine lowers the viscosity of the disc nucleus, changes its content from a hydrogel to a hydrosol, which improves fluid flow, and ultimately it decreases your risk of having damaged herniations and rotting disc, degenerated spine when you get older. Cerebrospinal fluid is rich in glucose and nutrients that the brain uses to function daily. You know, the ventricles of your brain make up about 800 milliliters of cerebral spinal fluid every day, and the brain circulates the fluids 4 or 5 times a day. The cerebral spinal fluid is normally circulated by walking in motion, but you can increase that by doing things like the wobble cushion. And so this is an example of going side to side on the wobble, and you're dropping your head to the side as well. From front to back, you are rounding your back out, pushing back with your hips, and then you're rounding your chest out and pushing or pulling forward with your hamstrings. You can also do this motion. It's not one that we do frequently in the clinic, but you can do a rotational, and you can start slowly. You can do a 1, 2, 3 count. You can do it 20 times each way. You can do it 60 times each way, but you want to be practicing deep breathing during those movements. There are other things that you can do while you're not at home, when you are at your office or you're at your desk. I know a lot of people are not at their offices right now, and so you can do this simple neck flexes or simple neck stretches where you're holding your collarbone down. So everybody do this. You can put your hand on your collarbone or on the front of your chest and just pull down and stretch your skin. Now, as you look up, you'll notice that the skin and even the muscles and the tissue underneath the skin start to stretch. Um, you want to do this at least every hour and a half or so. If you're driving across the country, you do got to stop. I know guys don't like to stop a lot of times, but you do want to stop and take care of this thing. And so you walk around the the car for 10, 12 trips and you get back in, but you need movement and you need to be stretching. And so this is one of our friends in Florida. This is him doing traction. And so this is a cervical standing traction unit. We have these in the clinic actually. You can do them anywhere. We have our patients take them home with us and or take them home with them and not take us home with them. Take the traction unit home with them and they do this at home and it's every single day and it's at least 20 repetitions. Our hope is that you slowly work yourself up to 30 to 40 a day, and as you're doing that you're stopping degeneration in your spine. This is a typical spine of a person that comes into Victory, and specifically this guy's name was John. This is one of my very first patients I ever had. He had extreme low back pain and a thyroid problem, and he was taking medication for a thyroid problem. His back, when we took a picture of it, when we took an X-ray of it, it looked perfectly straight. It was just the best looking spine that you could imagine. He'd been going to a chiropractor for a long time. He had pretty chronic back pain. I mean, he couldn't really stand up completely straight. He was already hunched over at the work at his job that he was doing. He was a mechanic, and um, from that picture on the right to the picture on the left took us about 3 months. But the relief that he got from his lower back just by working on his neck and taking the pinch out of the spinal cord that was up top, it really changed his life. His energy level improved. His thyroid function improved. He got off half of his medications for his thyroid, and so if he can do that, and he wasn't the healthiest person in the world. He was a smoker and a drinker, and didn't necessarily take care of his body, but um, very simply, he took care of his spine and got a lot better. This is a lady that I had, it's probably about 7 or 8 years ago. She really got just some very remarkable changes in her psychological analysis. And so she came into the clinic extreme anxiety and bipolar. She had numbness and tingling and sweating in her hands. She was going to go have her armpits, like the nerves in her armpits cut to help her hands to stop sweating. And the difference in that picture on the left when she first came in, remember that your neck is supposed to have a C-shaped curve in it like that one on the right. Now this is the same lady. This is the maximum correction that she would probably ever get at Victory. And that damage that's here, that before her head was sitting on front of those bones, it caused that degeneration. And you can count these bone spurs. There's one right there, so it's about 5 years old. That one right there is 5 years old as well, and that one's 5 years old. And basically, all of them are about 5 years old or so. This one probably is not quite that old as far as the length of time that it grew, but it takes every one of these bone spurs about 5 years. So we go 5, 10, 15. Hit that one right there is 20, and then that one, little one right there is probably 3 years old or so. And so I would say that's somewhere between 19 and 24 years ago that this actually really started. Now I remember that when she did start, she was in the military. She'd been in the Air Force for about 20 years or so, and so her timeline was right on for the emotional stress that came along with being in the military, but also the physical stress of being in the Air Force. And so, but her hands stopped sweating, her thyroid got better. She got off all of her drugs. We still have her bag of bottles at the clinic. Just amazing, a miracle. This is what a low back spine is supposed to look like. This is the pelvis on the left and the right. Obviously, the pelvis on the left is a lot lower than the one on the right. The spine, if you draw a line from, it's actually the second sacral tubercle that you draw it from, but you draw a line straight up. All things right in the middle, mostly. This is a this is a before and after picture of that spine that we just saw. So this is the original one that you saw, those straight up and down from front to back. That's a kidney that works at about 5%, and he was going to go have surgery on that. I guess they were going to pull it out. The difference between this picture on the right, the scoliosis that's right there, and that spine that's straight up and down, is a kidney that works at 51% after getting nerve flow and neurological function to that spine, that organ. This is Emma and Ella. They were twin girls that came in with banging migraines. That girl on the right there, has just had the worst headaches ever. And the top bone's supposed to be shooting up towards the sky. 31 degrees. Remember that one's perfect. You got the gap between the skull and the top bone. Obviously, that space is starting to close down. These spaces between actually C2 and the skull are starting to pinch that tissue. And this girl started getting adjusted. About 6 weeks, her migraines were totally gone. And so, just want to land on a couple things as we leave today. Number one is that your body's controlled by your nervous system. The only profession that I know that provides a doctorate in fixing misalignments in the spine, those subluxations that cause damage, is a chiropractor. And this is one of the reasons that you would go to a chiropractor. And so there are several levels of chiropractors out there. There are several different groups of chiropractors that practice together. Um, I would recommend that you find a family chiropractor, somebody that really seems to care, that somebody that also seems to know what they're doing, um, but is passionate about making sure that the nervous system is the primary thing that they're doing, because that's the primary thing that makes you healthy. And so, if you ever want to come into the clinic, you can always come to a workshop, or you can come to a dinner, victoryworkshops.com. If you haven't ever listened to a radio show, then would be honored if you go today. You can go on podcast or just about any iPod catcher, victoryhealthradio.com. We're on Instagram at Victory Health Center and victoryhealthcenter.com if you ever have any other questions. Hope you have a great day. Love you so much.